Okay, we're going to get started. I call the October Finance and Budget Committee meeting to order. I have requested that J.P. Johnson do us the honor of prayer and pledge this evening.
We praise you. We thank you tonight for allowing us to live in the greatest country in the world with the greatest government in the world and just allowing us to participate in the process. We pray tonight for all our law enforcement, all our first responders, all those people south of here manning our detention center. We just ask tonight that you give us wisdom beyond our knowledge to conduct the business of this government. In Jesus' name, amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you, J.P. Johnson. Ms. Patty, it looks like you're in charge of audio controls tonight. My panel's not working, so moving on to adoption of the agenda. Are there any amendments to the agenda? If not, do I have a motion to pass the agenda?
So moved.
Moved by J.P. Duncan, second by J.P. Johnson. All those in favor say aye. Those opposed? The agenda is adopted. We'll move on to our monthly reports. First up is Treasurer Hill.
All right, Treasurer's Financial Summary 4.1. We're at the three-quarter poll, I guess you could say, for 2021. And most years we can't say this, but revenues are coming in well above average right now. So revenues are good, expenditures are down. So, if you look at the bottom of page 6, we began the month with $90.4 million in the bank. We ended the month $90.7 million in the bank. 4.2, it's just comparisons over the last 3 years, January through September each year. If you look at the 2019 column, you can see wasn't in as good a shape then. The revenues didn't keep up with expenses, but if you look over to 2021, it has reversed itself, and now revenues are well over our expenditures to this point. 4.3, property taxes received by the general fund. A little bit up this month, $510,000 compared to $482,000 last year at this same time. I've seen already what we've got this month, so if you look at the October number, 1.4 in 2020, and we've gotten in 1.6 for October this year. So we're still doing well above last year. 4.4, 1 cent sales tax. This will be the final report of the old census numbers. They're finally, I guess, as official as they're going to be. And it looks like right now our share is 18.39%. And from now on, for the next 10 years or so, it's going to be 16.47, almost 2% drop. And that's about, if you go by 2020 numbers, that's about a $900,000 loss that would be split between the general and road funds. But the good news is the delayed census usually hits us in March for the January numbers, but it was delayed, 6 months? And that benefited the county $587,000. 4.5, the quarter-cent jail tax. Very good month, 13.15% over last year at this same time, and through 9 months, are already 1.2 million over. 4.6, local distribution sales tax. As you can see, everything is up above last year. I don't count the quarter cent radio sales tax in this. It just skews the numbers, but restaurants, electronics, both did well. 4.7 half-cent road tax. 170,000 came in this month. That's almost 11% above where we were last year at this same time. And also have an early peak of that for next month, and it's 16% up. So it just keeps climbing. I'm not sure. At some point, I think it's going to level off, but we just have to wait and see on that. That's all I have.
Questions for Treasurer Hill? Thanks, sir.
Thank you.
Next up is Mr. Driver with the Employees Insurance Report.
Well, good evening. The Employee Health Fund is up again this month, about $47,000 over the previous month. We started the month of September with $3.427 million, ended up with $3.474 million. So we're continuing to add a little bit to the fund, a little bit every month, and I'm kind of keeping my fingers crossed at this point because we are getting into the last quarter of the year. The employees and dependents have met their deductibles pretty much for the year. We're going to start seeing the typical run for the roses at the end of the year, getting elective procedures done and things that they couldn't afford to do before the deductibles were met. I don't see any spikes at this point from the loss reports that I've seen from our third-party administration. We don't have any large claims that are hanging fire right now, which is good news in a couple of different areas. I've gotten some preliminary renewal figures from our broker, and it looks like the excess loss, which is always the one that's really iffy, the one that we got tagged so bad on last year, it looks like we are not going to get the large increase that we were expecting. I'm expecting the excess loss carrier to come back without a rate increase for 2022. I'm not going to put that in concrete, Mr. Chairman, but it looks like that's going to be the case, that we're very little, if any at all, increase in the premium on the excess insurance. We've had no catastrophic claims this year, and that's a good thing. So you don't very often see a rollback on insurance premiums, but this is going to be one of those years I think we're gonna dodge a bullet. So right now we're on an even keel, and I don't have any recommendations at this point to make any changes as far as the health insurance funding as far as the employees are concerned.
Great, thank you. J.P. Johnson?
Yeah, good evening, Mr. Driver. I got two questions tonight. Number one, how do we purchase our fire and extended coverage insurance?
Well, the that's a separate issue from the employee health fund, but the fire and EC, the building and contents coverage, the commercial vehicle coverage, heavy equipment, et cetera, is purchased on a bid basis that we do every other year. We do an RFP for that on opposing years to the health services.
So it's bid for the entire county?
Yes.
Question is, if you look at this budget book, we've got budget line items that are showing level for the year, and we got budget line items showing it's requesting 400% more.
Well, if you're talking budget line items, J.P. Johnson, I don't have any input into how that's divided up between the departments. We provide the premium for the entire county. Part of that goes to AAC for what they insure for us, which is the commercial auto and the heavy equipment. And then the buildings and contents coverage and some other miscellaneous coverages are brokered for us through Brown & Brown, which is a insurance agency here in Springdale. When they get those premiums, they turn those premiums over to the Comptroller's office, and then they prorate those to the different departments depending on what their coverages are, buildings and equipment, et cetera. I don't do that part.
Tell me what you anticipate the increase in general to be in the fire and extended coverage.
I don't have those numbers, but I'll have to get back to you on that. I can get those and get back to you.
Okay, I have one more question.
Sure.
What's the status of our roof damage claim?
The claims are in process. We've got temporary repairs that have been done, and the negotiations are still, pardon me, are still ongoing between the claims people with the insurance company, and the county has retained the services of an independent appraiser, an independent adjuster, to make sure that we're, getting what we're supposed to.
Okay, what's your prediction on when it's gonna be settled? Because our temporary fixes haven't worked.
Well, some of them are working, some of them are not, obviously. I would have to defer that question to your chief of staff.
Okay, well, I'll ask him the question, because what I know, if somebody isn't bugging them every day to get it settled, none of those folks have any reason to settle it.
Sure.
JP Simons.
Thank you, Mr. Driver. Going back to the employee health care, you mentioned we do request for bid every other year on the other insurance. How often does the?
It's on opposing years.
Okay.
Yeah. The county, back, I believe, in about 2004, 2005, decided on the fact that the insurance programs needed to be bid. This was prior to the year 2000, when the county solicited my services. I couldn't tell you how far back it had been before any of the insurance had been bid. It'd been a long time. 2000 was the first year that the health and group life insurance had been bid in at least 10 years.
So that would put us looking for an RFP for 2022.
Yeah, and so.
You think that might have any
so-
impact on why we're not
Exactly.
projected to get any rate increase?
Yeah, and, we found out on the first go-round when we bid just the group health insurance that the incumbent carrier had been overcharging the county by 100%. We got bids back, for instance, for the group insurance for the employees at $40,000 a year, and the incumbent had been charging a little bit in excess of $80,000. And at the bid, the incumbent came back at 42. And that's one of those,
Yeah, that's why we bid.
yeah, that's why we bid,
Thank you.
yes.
Additional questions for Mr. Driver? Thanks, sir.
Thank you.
Next up is our Comptroller's report. Comptroller Worthen.
Six point one is the summary statement of operations. And through September, if expenses are linear, they should be at about 75%. And it's all been in your packet for review, but nothing really looked out of line. Then going to page 15 is the general fund actual expenditures at 65%. And then going to page 19, the actual expenditures for the county as a whole is at 56%. Then 6.2 is the unappropriated reserve balance report. And the only ordinances that affected the unappropriated reserves was the American Rescue Plan Fund, where we recognized the revenue, and then it appropriated $10,000 for the tenants, which leaves an unappropriated balance in the American Rescue Plan Fund of $22,400,000. And then the general fund reserves, the net general after deduction for the jail fund is at $9.6 million. And that's all I had.
Questions for Comptroller Worthen? Thanks, sir. We'll move to the unfinished business portion of our agenda. We have item number 7, an ordinance appropriating $350,000 from the Coronavirus Relief Fund 1005 to the pass-through payments line item of the Coronavirus Relief Budget for 2021. This was brought by J.P. Washington. J.P. Washington?
Thank you, Mr. Chair. So in August, we had Mr. Don Bennett from Tricycle Farms to come and present to us about the work that they were doing in the community. At that time, some members of the community stated that maybe they needed more time to be able to assess the supporting materials that he presented, and also suggested that we table this to see if there was, excuse me, an alternative outside of the Coronavirus Relief Fund. And considering the fact that we no longer have a Coronavirus Relief Fund, I would like to amend this ordinance to read an ordinance appropriating $350,000 from the American Rescue Plan Act Fund to the pass-through payments line item in the American Rescue Plan budget. I believe that this ordinance does meet the criteria that has been set forth in the American Rescue Plan. One of the objectives of this is to address the negative economic impact that is caused by the public health emergency. And I believe that Mr. Bennett and his staff did demonstrate how Tricycle Farms does that. And also, another objective is to serve the hardest hit communities and families, and also to invest in our neighborhoods. So I move to amend this ordinance as previously stated.
We have a motion to amend item number 7. Do we have a second? That amendment fails for lack of second, and I would like to comment on this. I believe we've also had a discussion about how we're going to handle non-governmental organization awarding these grants. So I would make a motion that we table this, or we postpone it indefinitely. And I think this would be an application that would be apt to run through that program when we get it established.
Second.
I have a motion to postpone indefinitely. I have a second by J.P. Duncan. All those in favor? Aye. Those opposed? That will be postponed indefinitely. Item number 8, I have invited the Central EMS personnel here this evening, specifically Chief Stewart, as we continue to talk about needs that are eligible and need to be funded through the American Rescue Plan. I've met with Chief Stewart and some of her staff, and they have some needs that they would like to maybe propose, and I invited them here for a discussion item tonight. Just a little bit of background. Central EMS is a quasi-governmental organization, and what we do is we split the EMS services as a county with several municipalities in the county. I think all the municipalities with the exception of Springdale. And so she's come here tonight. They put a list of needs together, and they have that amount. And then also, what we would be looking at in the future is possibly developing an ordinance to pay Washington County's pro rata share of these needs. So they would be something that they would still go out and gain support from the municipalities. So, Chief Stewart, I'll just turn it over to you, and then we'll give the body an opportunity to ask questions at the end of your presentation.
Thank you, Chairman Deakins, members of the committee. Again, I'm Becky Stewart, and I provided very brief information about Central EMS. The first page that you see is our 2020 annual report. And what's most important there is, again, that we're a quasi-governmental entity, and that we are owned and operated by Washington County and all of the cities that participate in the interlocal agreement, of which I've included in this information as well. What I want to point out on the annual report is the very bottom where it says our field staff, that's our EMTs and paramedics, and they've been the real unsung heroes through the pandemic. And I know that we talk a lot about healthcare, but sometimes we forget about the fact that the ambulance service in our communities are the safety net. And they're the first entry into healthcare for many of the population, and especially for those who are underserved. So our EMTs and paramedics deserve significant recognition. They've been for 2 years working in a very unpredictable environment. And while some folks, the law enforcement and the fire, first responders, we try to keep them out so they don't get exposed, but the ambulance central EMS crew doesn't have a choice, so they gown up and they go in every time. So I just want to put that out there. Last year we ran 222,000 calls with 12 ambulances. And on the back side of the annual report, you can see that we serve all of the communities in the county, and you can see the call volume over to the side. So if you're questioning who and where we provide ambulance service, I've heard people say central EMS is everywhere. And that is true for Washington County. We do not provide primary service to Springdale, but we do assist them mutual aid. The next page is our budget, and it is the 2021 approved budget. And I just wanted to point out that our budget is $14.7 million for 2021. That's what it cost us to operate an efficient, high-performance EMS service, and that's what our communities have come to expect. The last page, again, on that packet is the interlocal agreement, and that's just for your information. So let's move to the proposal. What I've found interesting in the last few months is that we've been the tip of the spear in the community for the COVID virus and the entry into the healthcare system, but we don't have any access to or direct access to any of the relief funds. So for the infrastructure and for the organization, we've had some minimal infusions, if you will, from federal government and Medicare and the HHS funding, but that's just minimal. So we, as an organization, wanted to bring that point forward and ask for some assistance through the county and all of the parties of the interlocal agreement. So we have two primary asks. The first one is 24 power load stretcher systems. And currently, our EMTs and paramedics have a stretcher that is powered and it will lift up from the ground. But then it has to be lifted into the ambulance. What's available now is a device that comes out of the ambulance and it picks up that stretcher and it pulls it in. So what that will do is reduce the need to lift the stretcher 100%. That's gone. And it will reduce the repetitive lifting necessary, and none of us are getting, well, most Americans, most of us are not getting thinner. So the repetitive lifting is an issue. And so with that device, we hope to see a lengthening of their career. And it's also a recruiting tool and a retention tool because we're the only service in the area who doesn't have that device. It's very expensive. It's almost $25,000 per ambulance. And any of our equipment is ridiculously expensive because it has to be 100% reliable. In an emergency, you don't want it to break or not function. So we're asking for 24 of those power loads specifically to help our folks that are out there on the front line. The second ask is 2 fully equipped ambulances. One ambulance was postponed for purchase from 2020 because of the unknown volatility of the call volume and our income and reimbursement, and who knew what was going on. So we postponed one that was scheduled, and so we did not purchase it. And the second ambulance we're asking for is because in a minute we'll see that the call volume has just spiked, okay? And we have not been able to add any resources to what we currently have. We were planning to do that in June of 2022, but we need to move that up and do it now. So that's 2 fully staffed and fully equipped ambulances. And the total amount there is the $2.2 million, and that's for both of those asks, both of those projects. And the first page is basically an overview of the program and why. And then as we go through, you'll see some of the goals of the program, and we want to invest in the health and welfare of our employees by reducing the lifting. And quite frankly, there's American Ambulance Association industry group, a representative group, did a survey of almost 300 EMS agencies and have found that over 1/3 of the employees who have come into the field in the last year quit. They're out of there. Not enough money, this is too much work, and I don't want the risk. So there's other issues coming down the road, but that's why we want to invest in our people with the Power Lift system. More information in there about the ambulances and the challenges we faced. We saw a 22% increase, and if you flip the page to the next, you'll see a chart. And the top black line of that line chart, and I'm sorry for the small print, but the top black line is 2021. And that is total call volume per month. So we saw heights that we've never seen before in the organization. And that number is 2,331 calls for August of this year. And that's almost 400 more calls than we had in August last year. But we know we can't use last year as much of a barometer because it was not normal. We're seeing the call volume come back down as the healthcare system is expected, that there's a lot of reasons that play into that, but we're starting to see it, but we're still significantly higher than we've ever been with the same resources. And there's just information here for you, for your reference. And the last point I want to make is on the last page. And Chairman Deacons mentioned that this would be a pro rata type investment of the American Rescue Plan funds from each of the owning, if you will, government organizations. We would ask us the same percentage of input for the cost of this project as is currently paid in for subsidy. So if Washington County looks like pays almost maybe 60%, give or take, of the subsidy, then that's the same percent we would ask for this project. And thank you for your time.
Thank you, Chief Stewart. Any questions? J.P. Simons.
Thank you, Chief Stewart. One question, going back to the power load stretcher systems,
Yes, sir.
the cost that you have here, is that just for the purchase of the equipment? And if so, how do you install those?
That's for installation and some training.
Perfect.
Yes,
Thank
sir. And we already have equipment that's compatible with that as well.
Any additional questions for Chief Stewart? I know she pointed out to us, but on that last page there's a line item for the rural county portion of that. It's 1.155 million. So this will be something that I invite the justices to continue. I'm sure you have her contact card here with the information she passed out. If you come up with questions for her after this, and then I think this will be something that me and J.P. Duncan will coordinate on through running that through possibly county services, an ordinance, and see what we can do to help you.
Thank you very much for your time. I appreciate it.
Thank you, Chief Stewart.
Thank you.
Okay, moving right along here. Item number 9 is an ordinance creating one position of deputy coroner in the coroner budget and appropriating the amount of $8,744 from the unappropriated reserves to the coroner budget for 2021. This was discussed and passed from Personnel Committee last night. This is to help, continuing to help Coroner Morris in his difficult time that he's having right now. Do I hear a motion on this ordinance? I have a motion by J.P. Johnson, second by J.P. Simons. Any further discussion, questions? Any public comment? I will bring the question. All those in favor? Aye. Those opposed? Item number 9 will pass to the full quorum court with a due pass recommendation. Agenda item number 10, ordinance creating the Criminal Justice Coordinating Committee Coordinator position in the county judge budget for 2021. This was discussed and passed to us from Jails and Law Enforcement Committee last night. J.P. Johnson.
By both Jail and Law Committee and the Personnel Committee, and I move we send it to the quorum court with a due pass recommendation.
I have a motion to pass with due pass recommendation by J.P. Johnson. Second by J.P. Duncan. Any questions or further discussion? Any public comment? All those in favor? Those opposed? Item number 10 will move to the full quorum court with a due pass recommendation. Item number 11 is an ordinance expressing appreciation for the county employees working in the county clerk's office during the COVID pandemic and appropriating $14,798.79 from the American Rescue Plan Fund 3046 to various line items in the county clerk budget for 2021. This is a continuation of some other ordinances that we brought for both the detention officers and the coroner staff. County Clerk Llewellyn came to me and said that throughout the pandemic last year, her office was open and serving the public, and she felt like they were at, of course, the increased exposure. I also want to highlight that, we're going to continue this talk. We discussed detention officers getting some premium pay, and I think we're going to continue those discussions for all county employees over the next couple months. But this is an ordinance for, of course, last year. And so I move passage of item number 11 to the full quorum court with a due pass recommendation.
Second.
I have a second by J.P. Duncan. Any further discussion? J.P. Simons?
Chair, just to refresh my memory, is this what was referred to as that premium pay or like it?
Well,
Or is this like a
no.
one-time thank you?
This was a bonus for
Okay,
last year.
okay.
And the way we mathematically came up with this was, I believe, if you remember, any eligible person was, I think, when we did the detention officers, it was $50 per pay period.
That's right.
Talking with County Clerk Llewellyn and the risks faced by her staff, I believe this was actually $40 per pay period. So it's a little bit different, but it's the same concept, as this is just a bonus for the working with the public for last year.
Awesome. Thank you for that clarification.
Any additional questions? Public comment? All those in favor? Aye. All those opposed? Item number 11 will pass to the full quorum court with a due pass recommendation. Agenda item number 12, an ordinance appropriating $35,000 from the property reappraisal line item in the Board of Equalization budget to the improvements and other buildings line item in the assessor's budget for 2021. I have here that this is sponsored by J.P. Pond, and Assessor Hill's here also, so whoever would like to come maybe speak to this, we'll get some background on it.
Thank you. For this, we had, in our reappraisal, I had to shoot pretty high this year because it was out for RFP for bid. But we had already had turned our budgets in, and so we didn't get the bids for our reappraisal contract. We're on either a 5-year or a 3-year cycle. So this last one was a 5-year cycle. The one we're currently on is a 3-year cycle, so it will go out for bid in 2023. So when I had to come up with a number and I had 0 bids, I didn't have anybody under contract, didn't know what they were bidding. I knew it was going to be more than the previous 5-year cycle. 5-year cycles are cheaper than a 3-year cycle. I bumped it up. We have some excess money in that line item, so that's where I was looking at. It kind of goes with item number 13, which we're looking at using some money to address some furniture, some office furniture equipment for the office. I'd like to do it coordinated together, where when we put new carpet in, the carpet, I don't know how old the carpet is. I know we were supposed to had this done a couple years ago. I think back when Judge Edwards was in office, they were going to start doing some things. Then we had budget cuts and freezes and things like that, so it got pushed off over the last 7 years. So I was going to use this money for that, and then coordinate it with, hopefully, if it approves to have new furniture put in, we could put the carpet down, put the new office furniture in, and be done with it, and not have to worry about it for another 20 years.
Thank you, Assessor Hill.
And it is a budget item, so it would be 9% of 35 would affect the county general.
Thank you. Any questions for Assessor Hill? I'd entertain any motions on this item.
I move passage of item number 12.
I have a motion to pass to the full quorum court with a due pass recommendation by J.P. Duncan. Second by J.P. Johnson. Any further discussion? Any public comment? All those in favor?
Aye.
Those opposed? Item number 12 will move to the full quorum court with a due pass recommendation. Item number 13, an ordinance appropriating $265,000 from the American Rescue Plan Fund 3046 to the small equipment line item in the assessor budget for 2021. J.P. Duncan.
I had the opportunity to meet with Assessor Hill, and he walked me through this proposal, and that's why I sponsored the ordinance. But his office obviously has remained open and is a high-traffic area. As we met, and he walked me through the plan, so I won't steal your thunder, turn the floor to you in just a minute. But this made sense to me to come through American Rescue Plan funding, as it would reorganize the office to minimize contact and have better flow for the public. So with that, Assessor Hill, I'll pass the floor to you.
Okay. Yeah, we're looking at the furniture is be turning 19 years old next year, but the most important part of this is the cubicles that we currently have are much shorter. They're about eye level, and the ones that we're looking at replacing them with add 2 feet to that. So when people are walking by, they're not staring down or talking down onto the workers that are there. The biggest thing too is our cubicles, people face each other. And so they've got a cubicle that's eye level, and they're working across facing each other the way that they're designed and created. These new cubicles, they will spread them out further apart, and they're back to back, and they're 4 feet apart, facing opposite directions of each other, so they're not all facing in. So it's going to create just a safer, from spreading any kind of germs or anything, definitely with COVID. We also have barriers set up. We have no place when customers come in, they sit down right here next to the person. We will have barriers set up where they will be sitting on the other side with a glass barrier in between them. This will be something that will be a permanent fixture, and again, help cut down on sickness, time missed, and things of that nature. So I've got some pictures of what they look like with a little diagram. I can give that to you guys here. And then I know we have JP's also sitting there. I've got some for them as well. And if you have any questions about any of this, feel free to contact me. I'll take you through the same presentation I took J.P. Duncan through.
Any questions for Assessor Hill? I take a motion. Oh, just a second, I'm sorry.
Thank you. Assessor Hill, since this is being requested out of the ARPA funds, the 9% effect to the county general, that's not.
This would be
applicable, correct?
it would be American Rescue Plan Fund, so it would have zero impact on the county general. I know there's a smart concern by the quorum court that when you disperse these funds, if they don't qualify, the county's on the hook to repay that money. In the case that if something happened that this did not qualify, from what I've been told by several folks that this would definitely qualify, but if it didn't, the county would be on the hook for less than $23,000.
Okay, thank you.
JP Duncan?
I move passage of item number 13 to the quorum court with a due pass recommendation.
I have a motion to pass by JP Duncan, a second by JP Simons. Any further questions or discussion? Any public comment?
Hi, Sarah Moore, Fayetteville. I'm not in opposition of the potential that we do these improvements to the assessor's office. Obviously, we want the staff to be safe. For several months, or maybe longer, we've discussed, though, the fact of talking about that we have X amount of dollars, currently $23 million, and another $23 million next year, and we've been piecemeal spending these. I have a lot of concern about that, just like you sit at the kitchen table with your family budget and you look at what total money you have and you look at all the needs your family has and you look to figure out which projects, which things you can do within your family. The county needs to do the same. The art funds in their language talk about the highest priority needs to be those individuals have been the heaviest impacted by the pandemic. We have yet to address anything in regard to food insecurity, small business relief, folks that are kind of hanging on by their fingernails. And so I would like to ask what Judge Wood brought forward in one of the meetings in the past about having a full conversation about these monies and making decisions together on the things we're going to invest in. We've done $250,000 for architectural services to do the juvenile center, $250,000 for a jail expansion, and now it sounds like we're in that ballpark for this type of thing. We're close to $1 million already. And then the construction costs alone for the juvenile building and the jail are going to eat up the rest of the $23 million. And I have a lot of concerns about that because, again, we haven't even spent $1 on food, and we're a very high food insecurity county. So I would like to implore you to not move forward with moving this ordinance forward tonight until we do have that full discussion, and not to pass another ordinance on any of the spending on the art funds till we fully vet with our community what the needs are and all the projects possible before we make any spending. Thanks so much for your attention tonight and your respect listening to my words. Appreciate it.
Public comment. Okay, we have a due pass recommendation by JP Duncan, a second by JP Simons. All those in favor? Aye. Those opposed? Item number 13 will move to the full quorum court with a due pass recommendation. Item number 14, an ordinance appropriating $88,546.30 from the unappropriated reserves in the general fund to the Taser line item in the sheriff budget and jail budget for 2021. If you will recall, when we passed the budget out of this committee, we had a discussion in that meeting and we asked that the sheriff remove the full cost of the tasers from next year's budget because he has the ability to break that cost up over 4 years. This is the first installment of that, and the sheriff's department would like to get this funded before year end to take care of take advantage of some credits by the vendor. Do I have any motions on this item? I'll move passage to the full quorum court with the due pass recommendation. Do I have a second? I have a second by JP Johnson. Are there any questions or discussion on this item? Any public comment? We'll bring the question back. We have a due pass recommendation, or motion for due pass recommendation by JP Deacons, second by JP Johnson. All those in favor say aye. Aye. Those opposed? Ayes have it. Item number 14 will move to the full quorum court with a due pass recommendation. Item number 15, an ordinance recognizing additional revenue in the amount of $62,199.20 and appropriating the total amount of $155,983.40 from both the general fund and the jail fund to various line items in the sheriff budget and jail budget for 2021. These are some costs. As you know, the Sheriff's Department provides special event security and gets some revenues in from that. And this is us accepting that money in the general fund and reappropriating it to the sheriff's budgets. Any questions or discussion on this item? I would entertain a motion on this item.
So moved.
I have a motion to pass to the full quorum court with a due pass recommendation by J.P. Duncan. Second by J.P. Simons. Any public comment? Seeing none, all those in favor of item 15?
Aye.
Those opposed? The ayes have it. This will move to the full quorum court with a due pass recommendation. Item number 16, an ordinance deappropriating surplus amounts from full-time salaries for various departments and restoring those amounts to the unappropriated reserves as required by the 2021 budget controls for the third quarter of 2021. This is a ordinance that we passed quarterly. This is the sweep from the unused salaries and wages line items in the associated budgets, and this will go back to the general fund. I might specially call your attention to the second page, line number 55. That is the jail operations, and we're going to sweep back $428,000. Any questions or discussion on this item? I'd entertain a motion on this item. I have a motion to pass to the full quorum court with a due pass recommendation by J.P. Johnson. Second by J.P. Duncan. Any public comment? Seeing none, we'll vote. All those in favor? Aye. Those opposed? Ayes have it. This will move to the full quorum court with a due pass recommendation. Item number 17, an ordinance recognizing and appropriating revenue in the amount of $420,470.09 in the road department budget for 2021. It is a historic moment. We've received some federal grant funds due to some damage in flooding, and this is us accepting those funds and appropriating them back to the road budget to reimburse them for repairs that they have been made. Any questions or discussion on this? I'd entertain a motion.
So moved.
I have a motion to pass to the full quorum court with a due pass recommendation by J.P. Duncan. Second by J.P. Johnson. Any public comment? Seeing none, we'll bring the question to the body. All those in favor? Aye. Those opposed? Item number 17 will move to the full quorum court with a due pass recommendation. J.P. Duncan.
I move we add items 9, 10, 11, 12, 14, 15, 16, and 17 to the consent agenda.
I have a motion to pass items 9, 10, 11, 12, 14, 15, 16, 17 to the consent agenda by J.P. Duncan, second by J.P. Johnson. All those in favor?
Aye.
Those opposed? Those items will be added to the consent agenda. The final item on our agenda tonight is public comment. set by ordinance, we have a 12-minute public comment period with a 3-minute limit for each individual. I will open the floor to public comments. Seeing none, this meeting's adjourned.